Welcome to my podcast. Today I'm going to talk about another case that I read, and I felt it's very important to shed some lights about it. So after you introduce yourself and double check the patient name, date of birth, the patient might present with certain symptoms or might present in the A&E with acute manifestation and basically this patient, he's in mid-30 and presented to the A&E with sudden red hot itchy rash in his back for the last half an hour and was coinciding with headache, and he just self-administered antihistamine, and his wife has the same symptom. However, it has settled, but in his condition it did not. So the patient, when you examine him, of course, in A&E, after you ask it his name and the date of birth and just double check that he's the patient in the system, you will ask, do you have any thought? What might be the reason? Have you had anything recently? Do you have any allergy? And since when, we know that it happened for the last half an hour, we'll ask if there is any other related symptom or linked symptom in the previous few weeks or few months. And the patient deny, and he has no known history of allergy or any recent medication, and he's otherwise fit and well. And the patient might say that I was fishing because this is what I do, and you will ask, do you stay in the sun for quite a long time? Do you take certain precaution? And the patient says, no, I'm just wearing always sunscreen, long sleeve, shirt, and a hat whenever I go outside or outing. He will just say that I caught a fish and I just ate it while I'm sitting in the beach, and the temperature was a little bit high, and his wife also tasted that fish and had mild symptom. So when you need to examine the patient, he will show you his back, and obviously the rash, it's in the sun-covered area, so it has nothing to do with the sun whatsoever, so you're not going to think about solar urticaria. You need to think thoroughly from the history being given, which obviously could be poisoning or allergy, basically, to the fish he had. So you will ask, what sort of fish have you had? How did you cook it? Did it look like normal or contaminated? The patient might say that I just caught it and just I fancy that fish and I just ate it, or maybe he ate it even raw without cooking. And we know with the temperature, if it's a high temperature, especially if it's more than 4 or 5 centigrade, the fish can't stand that, and this might cause certain poisoning. So when you examine the back, you just see, as I say, some redness, which some may be scratched because of the itching, but there is no wheal whatsoever. And this will rule out allergy or urticaria. So in this condition, you'll think about poisoning, as I say, and there is a kind of poisoning which is related to certain fish, which is called scombroid poisoning. So it's basically a contaminated dark meat fish, was called under category of finfish, and belong to a family of this one, scombroid or Scramblosidae. And this constitute basically tuna, mackerel, skipjack, bonio. And the symptom reported also with certain other fishes that we are aware of, and some new names, so like bluefish, herring, sardine, salmon, anshuga, marlin, swordfish, amberjack, and mahi-mahi, and trout, and talibia. So if the fish, for instance, is improperly stored, and as I say, the temperature can be something more than, of course, 4 or 5. And in that condition, of course, we know that the bacteria will overgrow And this will lead to conversion of histidine to scrumbotoxin, which will be with higher level of histamine, which is the main toxic thing in this condition. And within 2 or 3 hours of the storage, the fish might taste, like you say, strange. You're gonna feel it like bubbly or spicy or peppery. And the symptom can, of course, range from something like redness, itchiness, to serious cardiovascular manifestation or GIT, like diarrhea, nausea, vomiting, headache, as the patient presented. Or it could be flushing. The patient may be flushed because, he has high level of histamine, and histamine will cause, of course, one of the things is redness. It could be also respiratory manifestation, could be serious, like bronchospasm, and especially if the patient has some sort of respiratory cardio manifestation or disease or any other problem. So he might present with bronchospasm, coronary vasospasm, which might give like a pulse, heart attack, and fainting, maybe drowsiness, collapse due to hypotension, and also can reach to tachycardia and arrhythmia. So based on those manifestations, usually the diagnosis is clinical. And if it's suspected and the patient has the fish, it can be sent for examination to detect the level of the histamine in order to perform diagnosis. However, like in his condition and his wife, she presents mild symptoms, so it can be self-resolving, or maybe with the self-administering of the antihistamine as he took, and this can be fast-acting. And if, for instance, the patient has, as I mentioned, gastrointestinal symptom and he's not responding to the antihistamine, so maybe we can treat accordingly or treat in the A&E, and it might warrant urgent medical attention to the clinical presentation the patient presented with in order to manage the situation. So for instance, if he had presented with respiratory failure, so this condition needs the A&E review urgently. And what other differentiation we could think of as the patient presented with this rash in the sun-protected area? So this would rule out the pseudo urticaria or sun-related rashes, because that kind of rash will appear within a few minutes of the sun exposure and will resolve within, of course, cessation of the exposure. The other thing we need to think of is allergy. If the patient has known history of allergy or anaphylaxis, or if he has any previous anaphylaxis to certain food, like certain people, they have for peanut, fish, strawberry, those sorts of things. But it's usually associated with raised wheels. So in this condition, it wasn't the case. And the other thing that we need to think, as in this condition, if any other people who had from the same thing, so it's like clustering with the same manifestation, if it was the same fish, say for instance, they cooked it together, one family, and they ate it together, so in that condition, this will warrant certain attention. That's the reason for that kind of thing. And of course, if by any means you thought of allergy, you'll arrange for, of course, skin allergy test like skin prick or IgE, just to confirm. So by that, I just told you about this condition, which obviously from presentation, you need to think about, as I say, especially if it's in a sunny area or a hot country, you'll think about sunburn, like in Australia, any other places whereby the sun is, or in the Gulf area as well. But I'm not sure if they have that hobby of the fishing, but in the Scandinavian and in Australian, they have this hobby. So the first thing you need to think of is the sunburn, and you need to think thoroughly if there is something fishy as well, like the conditions, situation. I hope by that I covered something interesting. Let me know in the comment if you come across something like this, and how would you approach it, or if you have come or encounter such a condition. Thank you.